Great. So at the Career Center, just to kind of give a little overview, we do advising. So Kyra and I are advisors, and we work in different career communities. So we have 5 here at DePaul. Kyra's healthcare, I'm tech and design. And let me share my screen really quick of all of what we do. Sorry. Oops. Sorry, I'm like battling like 3 different screens right now. Okay, here we go. So this is the Career Center homepage. You can access everything on here. Here we can look at all the career advising and then the career communities as well. So here we have them all listed. You can join any ones if they appeal to you and your interest. That's what's so great about them, is it's not dependent on necessarily your major, it's just all your interest. So we have all of these that you can look at and everything. Also in the Career Center, we have a career library, which can access all of the information that you would need regarding like resumes and stuff that Kyra and I touch on in our advising appointments. So, you know, you can go through and look at all of that. Great. Let me pull up. And then we also offer like LinkedIn and resume reviews that are asynchronous. So you can access that through this link, and you can get it. It's asynchronous. It usually comes back in like 5 days. So that's good if you don't have time to meet with Kyra and I or anyone else in the Career Center, just to get your resume looked at and everything. Also, we offer UIP courses. So UIP is University Internship Program. So that encompasses, a lot of it is 2 credit classes that kind of help you exceed in your career and future goals of that matter. There's a bunch of different courses and you can sign up now because registration's open for next year. So those are great. I think there's maybe 1 or 2 like 4 credit classes, but most of them are 2. The career library, which I touched on, has like all encompassing. I can send the link in the chat. It's probably easier to access for everyone there. And then also how you got onto this. Zoom on Handshake is a great way to look at jobs, events, and book advising appointments with Kyra, I, or anyone else in the Career Center. And then also Kyra sent in the chat earlier, you can join our career communities newsletters. So those would be under a Google Doc form. You can also join whichever ones appeal to your interest. And those are great ways as well to get connected. Also, lastly, we have our separate LinkedIn pages. So you can connect with us. You can connect with anyone really on there. There's alumni, current students, and everything. There's 2 LinkedIn links there. One's the tech and design, one's the health and career science, or the health and science one. So that's all on there. And yeah, we both share our like events and upcoming like important things that you need to keep out for. Also like job opportunities are all on there. Those are just a few ways to get involved in the Career Center. There is kind of a lot there, but you know, everything's accessible on the Career Center homepage and everything. And we look forward to chatting with you guys if you come in and visit with us. So Kyra, on to you.
Awesome. Thanks, Skylar. There's a lot of links in the chat. Feel free to save the chat by clicking the chat box. And then there's 3 little dots on the right-hand side and then press save chat. So all of the links can be saved and you can look at it later when you have time. But for now, this is the main part of our panel here today. It will ask Dr. Roselyne some questions. It's an interview type portion. If you have any questions, again, feel free to message me or Skylar. and we can get started. So Dr. Roselyne, if you can introduce yourself, what you do, pronouns, all that fun stuff.
Okay. Yes. So I am Roselyne Tchoua, she, her, and I have been at DePaul for 3 years. I'm an assistant professor. I teach data science course, DSC 441 and DSC 478 mostly so far. And I research in data science. And data science is by nature, I think, interdisciplinary, but my research is between data science and scientific applications, including healthcare now.
Awesome. Okay, so yes, so you mentioned that you are conducting research here at DePaul. So what is your research project about, and what do you hope will be accomplished with your research?
Yes, so I want to talk about the one that is about health equity, of course. So I have a project with Sinai Urban Health Institute, so it's SUHI for short, but so it's a special institute that is concerned with health equity. And they have a very cool program, I think. So they have community health workers that are the liaison between the hospital and the patients. So these community health workers come from the neighborhoods where the patients come from. And when they leave the hospital, these CHW, community health workers, can follow up with the patient and basically try to reduce the rate at which they come back to the hospital. And they do that by collecting social determinant of health. So that's information that is not related to their, health per se, but like social factors that impact their health. So that's the two very interesting part of the project, is to leverage what these CHW know and how they work, and also that social determinant of health data is what I call it. So what I expect, or what I hope to achieve, is that, well, they already know, they already think they're making a difference by having these program, right? This special program. They see a small decrease in the readmission to the emergency department for people who who are followed by those CHWs. But what I hope to do is systematically analyze that. Why is that making a difference? What part of the data? And right, so quantify exactly what are they doing right and why this is successful.
Awesome. All right, so how did you decide to focus on your research? So what led you to this path?
Right. So before coming here, I was working between data science and material science, and even like text data and material science. So I came here, and I still have projects with material science data, but then I'm always looking for like other applications. And of course, like in science, you want to say you can work with this, but it should be, doable in another field. So I working at DePaul and knowing more about the office, the provost of research and her position, I found out about this Sinai fellowship, so SUHI fellowship. They work with different faculty from all over the country, actually, not always local. They have fellowship of people that work with them for a year and help them work on something that they're looking at. So I heard about this program, I applied, and I became the SUHI fellow for this year.
Awesome, congrats on that.
Thank you.
Awesome. So what advice do you have for students interested in careers in addressing health disparities and focusing on health equity?
Sorry for the train. I'm going to be a little bit loud.
It's okay. I've been muting too because the train.
Yeah. Okay. So I was thinking about this question, and I guess the one thing I will say is that this area is definitely not, this project is one small example, but this area of health equity is completely booming. So if anybody's interested in that, they should definitely pursue it. It's like very often now that I see in the news some example of health inequities, some problem that people discover about not addressing all the needs of some minority or maybe women or different things. So it's a booming area and there's a lot to do. And so I would say go for it. And I would say definitely data science, there are people who are doing it directly, right? So in health in health, like health workers, nurses, maybe that are looking at this kind of things. But in data science, there are a lot of projects that are trying to document this and show attention to this so that people work on it. So data science is a good area to look at. And I would say that if you're gonna go the data science route, to also be interested in ethics, right? So I think that people need to be trained in multiple things when they are tackling a problem like that, right? So that's what I would say.
Yeah, I mean, in the news, there's like the formula shortage. So there's always something going on that can, be looked at more closely.
Yes.
Awesome. So how can technology help with health equity?
Yeah, so one thing that I just kind of mentioned is that I think at the very least, it can really systematically document what's going on, right? So that people are convinced that there is a problem. And so in this case, in this project, but in other cases, if you are able to show that there are inequities, that some groups are not being served correctly, that's one thing that technology can do. And then that in turn makes people able to make more informed decisions. So for example, in my project, and maybe I can give another example, but in my project, if this works and I'm able to document why this is improving the rate of decreasing the rate of readmission and how, right? Then Sinai is going to open more clinics or open programs in more clinics that will do the same thing. And then there will be more people that can be served by that kind of problem, right? Like looking at social factors that impact our health and seeing how we can improve that. So technology, I think, will help show the bias where it exists and then help address the bias because people can make more informed decisions.
Awesome. Yeah, people like the data, so anywhere to get that for sure. Awesome. And then the last question before we kind of open it up to the floor is, so what advice do you have for students that are wanting to get into research?
So at DePaul, for example, I think so. I personally do independent studies. So I would say that's a good way to kind of dip your toes into research. Is do sometimes what I would say, for example, is instead of doing one independent study of 4 credits, it's better to even do 2 and 2 credits at a time, because I think research takes longer. It takes reading and writing. So I would advise to try and find a project that they are interested in and try to spread out the research over 2 quarters so that they just get more of a better sense of what research is like.
Awesome. Yeah, sorry, I forgot. There's one more question, is how can we fund the need for technology in health?
Yes, I saw. So for that question, I say, like, for me, in my position, for example, right? So I would apply for proposals. So one of my goals with this fellowship is to find proposals. So I would go to NIH, the National Institute of Health, and National Science Foundation, and I would pitch this problem and I would ask for funds, right? So I think this is what we do, and then we get people to work on projects. That's one thing we can do. And I think the other way is to basically also convince hospitals that they need that, right? So we say it's very good not to bring the patient back within 30 days, right? So they're happy. But who else is happy is the hospital. The hospital spent too much money on the emergency department, right? So if Sinai sees the benefit of this program, then it will also promote it and fund it because it is also saving the hospital money, right? So I think finding ways to show that this is not just for people and patients, which is great, but it's also for better hospital management and things like that.
Awesome. Thank you so much for sharing. I think this is super important in terms of the health community, the health industry. Sorry, that's what I meant to say. Going on right now, it's important to limit people's time and money and all that fun stuff. But now it's time to open up the floor in case of any of you guys have questions that you want to ask Dr. Roselyne as well. So feel free to send that to either me or Skylar through the chat, or feel free to unmute as well. In the meantime, one question is, what is one piece of advice you would have for current DePaul students looking to pursue public health?
So I am more in the data science side, but yeah, I would say that picking this topic, for example, will make them stand out, right? So public health in addressing this kind of very important, but also current problems, right? So I think that's a very important thing. Like you said, I think data right now is a very hot topic, but health is a very hot topic too. So you mix both and you have
got something there.
Yeah.
Awesome. And then oh, sorry, Skylar, go on.
Yeah.
Sorry, you're so fine. I think there's a little bit of delay, so I didn't mean to shadow you. But you kind of talked about some intersection between different fields. So you talked a little bit about ethics. Like, what other fields do you think are important? Because healthcare is like so overencompassing of everything, and just one side is tech. But of course, like, what do you think is kind of like an ethical, or like not an ethical, you mentioned ethics, but like an approach to kind of encompass everything, especially for students who are kind of like, in data science or in healthcare, in anything else, but wanting to go into kind of that field? Like, what do you think are good, like, transferable skills in that area?
Yeah, so if I don't misunderstood, just tell me again. But like another field that's ethics is one thing that you may not think about that's very related to this. And another thing that I think is very important in healthcare and not obvious is data integration and data security, right? So the other big problem with healthcare and finding data in healthcare is getting the hospitals to talk to each other and exchange data and agree to exchange data, having data agreement. So this is like, seems like a nightmare right now for many cases, right? So people who work in data integration, data security, I think they have a lot of work to do too. And maybe even policies, right? So just working on policies for healthcare and finding ways to exchange data across hospitals. That is a whole big topic that I don't even address.
Totally, yeah. No, there's definitely a lot of overlap, and I kind of find that even just within my classes of, I learned that in another class. So I think touching on it here is really interesting. Thank you.
Awesome. And one question that I have is, what do you hope the ER systems will look like in the next 10 years? I know you kind of touched up on it, but kind of a more in-depth, like, what do you think it's going to look like? Or what do you hope it would look like?
What I hope for. Okay.
Yeah.
So what I hope for, and then what there's what I hope for my project, and then what I hope for in general. So what I hope for my project is that I can show that this kind of approach will decrease people just coming back because we're not addressing needs that they have, right? It's not about their body mass index or their weight or something. It's about how they live and transportation needs and primary care doctor, all these things. So I hope that this kind of program would really help decrease people coming back to the ER that don't have to. And then more broadly, without getting, too political, but I think more broadly, what I hope for the emergency department is that people who don't need to be there don't have to come, right? So healthcare is such a, again, big topic right now. And what happens is people use it instead of a primary care doctor, right? So sometimes what they need is not really going to the ER, but they go because this is what they can do. So that's what I hope will slowly decrease, is that the ER will really be for emergencies and not for people who basically need healthcare.
Mm-hmm. Yeah, the whole health industry, I mean, obviously needs some work. So I'm glad that, people are recognizing it and taking steps to fixing it.
I can ask another question?
Go ahead.
What do you think like people, just like ordinary people, can kind of do to make healthcare more accessible or more like equal between, like, you touched on like transportation and stuff. So like, how do you think we just as like regular civilians can kind of help to combat these issues that we find in the healthcare industry?
Yeah, that's a super hard question that I wish I knew also, so I could do more. But I think, what I think we can do is kind of pick politicians that are saying the right things, hopefully, right? And here I'm just looking at Chicago patients and one set of Chicago patients. So I could look into who is trying to look at this program and who's trying to fund this program and who's recognizing it, like you were saying, who's even recognizing that this exists, and then try to put them into a position of power. That's what I think we could do. I think that it's sometimes hard, right? So we're all running around and not necessarily knowing all of these details, but I think finding out I understand about health equity, and finding people who recognize that. I think that's a big good start.
Definitely, yeah, I fully agree. It is a hard question, but I think I think this is a start, just being at this panel and kind of discussing it and seeing the kind of work you do and everything. So that's great.
Awesome.
Yeah, and that's another answer to your question too. And so if you go into this field and you try to work in this area, then that's also definitely doing something.
Awesome. Well, I
see a question. Yeah, and I that's a good question, because I was expecting this one actually. I'm finding a lot of challenges in this data, and definitely even compared to financial data, I can imagine. So I think that financial data probably exists out there, maybe noisy, but it's there and it's very concrete. Finding with healthcare data, but especially not even just healthcare. Like, I'm not working with medical records, right? Which would be consistent and structured and everything would be ready to analyze. One challenge that I'm finding with this kind of social data is cleaning it, right? So before you can even apply anything, it's like, well, people are entering this data and patients are people too. And these questions are not, again, something that you can measure necessarily, like weight and height. They're survey questions. So that's a big challenge, I think, for this type of data, is trying to really detect whatever signal is there in that kind of question. And one of the outcome that I didn't mention is being able to suggest to them how to do the work better, right? So maybe don't ask so many questions, or ask these few questions are the most important one. And I hope to detect that kind of signal in this data. It's definitely more challenging than some of the data I've had before.
Awesome. Thank you so much for your question. Follow-up.
Yes, absolutely. And part of my goal, even though, again, it's taking a long time to clean the data, but part of my goal is to go to them within a couple of weeks and show them what I find, right? And I think that I didn't talk about my specialty, or what I really like to do is to involve the experts in the field. And I think in this case, they are my experts, right? So they're not the material scientists that I had before. They are basically community health workers, and they know the data better. Sometimes, for example, they will ask a question and the patient may not respond, or may say, I don't know. And they may have a sense of if a non-answer is a no, or it's a maybe, or like, so I think there definitely needs to be a closer fusion between us and the CHW. And I hope even to find a way for them to inform whatever model is coming out of this project.
Awesome. Okay, I do not have any more questions. If you have any questions, feel free to shoot me a message, me or Skylar a message on Handshake, and we can send it forward to Dr. Roselyne for future, so like I can get that answer to you. But awesome. So there's a closing, Skylar. I'm going to toss it over to you.
Yes. So thank you again for answering questions. Sorry. So we just have a little poll that we would like everyone to answer. I will send it now. Give me 1 second. Okay.
Awesome. We'll leave that up for you guys to do. And after you fill out this event poll, you guys are free to go.
Thank you.
Thank you.
Thank you for coming.
Beautiful. I'm going to end the poll. Oh, was someone? Oh,
Thank you, Kyra and Skylar, for organizing.
Yeah.
Thank you.
Thank you for having me.
Yeah, thank you, Dr. Roselyne, for coming, spending the time to talk and dealing with my planning calls.
Yeah.
But
It was
we
just fine.
appreciate it. Thank you.
Thank you. Bye-bye.